Details on PaperCut MF coming your way stat. Hey now, good afternoon. Welcome to our healthcare webinar from ACDI. I'm Doc Balgi, Technical Solutions Specialist. Exciting news for ACDI. We've just celebrated our grand opening of the new state-of-the-art global headquarters in Benton, Arkansas just a couple of days ago. I tell you what, we are poised to forge ahead. We're going to enable our teams to be more effective working with all of you. So keep tuning in. Lots of great stuff coming up. I'm just so excited about that. And as for today, welcome. Hey, thanks for joining. Well, for your appointment with the doctor today, we have the following items on the agenda. We're going to dissect some print cues, ID numbers. We'll pull out some patient charts, even talk about your overall health. Of course, another chance to win a very cool ACDI t-shirt or polo. Simply pay attention to the presentation and we'll ask a trivia question. Then time for your Q&A right after that. All right, put the magazine down. Name's been called. Time for your appointment. Let's get started. At the heart of PaperCut is Find Me Printing. Now, we talk about it frequently. Of course, it's very important for nurses, assistants, office staff to be able to print securely and grab their job anywhere. You know, that's a great way to satisfy just one of the basic requirements of HIPAA. This is done by redirecting print jobs to the device that's in front of the user, no matter where that user is and no matter what that device is. This is called a roaming print service. You know, print jobs find users based on their physical location, and print job redirection happens when a print job is taken from one queue and transferred to another. Here's how it works at a high level. The user prints to a single site-wide global queue. They walk up to an MFP with embedded PaperCut license in it, authenticate with a swipe card, maybe an ID number, username and password, locate their job, and release it. The job automatically prints out on the device in front of them. Now, to set up the virtual queue, one must first diagnose the situation to determine the best driver or drivers to be used. Use a single virtual queue when you're in a single location. Or maybe the printers are all compatible, like the same make and model, or they all use the same driver. Now, some universal drivers are better than others. I will tend to stay kind of device-specific whenever possible. Use multiple virtual queues when you have different printer types, like wide format, production units, and workgroup MFPs. Or when you have multiple sites with local servers. That way you keep the job local right there to the device. Another option that's available is the PaperCut Global Print Driver. This is a basic PostScript driver. And as long as your device is capable of using a PostScript driver, then this output will go to anything. You don't have any finishing options, but this will produce toner on paper with any device. Here's how we create a virtual queue in PaperCut. On the print server, create a single queue or multiple queues using the same or compatible driver as the device. Double check that if you have PCL on the front end, you need PCL on the back end, and the same goes true for PostScript. I generally recommend using a null port to ensure no accidental output happens. However, if the printer complains or if you want to pull down device options, then point the queue to the IP address of the printer as you would normally do. Give the queue a friendly name so the end users will be able to locate it easily. Here's a great tip. If you use virtual in the name, then the printer queue type in PaperCut will automatically change to virtual. After you create the queue, then check the Printers tab of PaperCut to ensure it's registered. Now, if you didn't put virtual in the queue name, then just click the Printers tab, select the queue that you want, and set as virtual. These jobs will be forwarded to a different queue for output. Right below the queue type is the section to select the appropriate printers for the job to be redirected to. Again, a good naming convention for your queues makes this process easy. Don't use the default names of the queues from the print driver. Enough said on that. Scrolling down to the next section, we find the hold release queue settings. You enable the hold release queue checkbox, and then in release mode, you can select one of the following: user release, that is the default option, or only managers can release. Then, of course, click OK. Also note the advanced configuration options. So this is where you can enable a printer to show up under web print, turn on print archiving, hide document names, even apply watermarks. And we're going to look at those in just a bit. To configure multiple printers with hold release queue support, use the copy settings to other printers function. Couldn't be easier. Configure one printer as required, click copy settings to other printers, and then select the printers to copy the settings to. Now, note the other options that are available with copy settings. You have devices, printers and devices, and printer device group settings. They can all be copied from one to another quickly and easily. Now we can enable print release on the MFP. Simply select the source queue or queues. Version 17 now includes intuitive responses to make your selection easier, especially handy if you've got a long list of printers to choose from. Many manufacturers now even support blocking the release of jobs when the device is in error. That checkbox to enable is right below the box for Find Me support. And we're going to click that now and configure it. When you tick the Enable Find Me Printing Support box, this window opens up. Here you can release to a single queue or use the multiple queue to different operating systems. Another handy feature when you might have PCL coming from Windows and PostScript coming from Macs. Also a load balancing option. Now, some healthcare organizations that are providing educational services will use this so test results can get routed to the most available printer with the student's name right on the document itself. Using Find Me Printing or Secure Release gives the protection needed to satisfy HIPAA regulations. You know, one of the biggest violations cost Advocate Healthcare $5.5 million. Securing their output might have changed the outcome for that decision. To release your jobs, you need to authenticate. ID numbers provide a convenient way to do that at the device. And there's a few ways to auto-generate identity numbers in PaperCut. Let's take a look at them. Here's one method to auto-generate random numbers for users. Even email them with their ID automatically. In the Options User Features area, select Auto-Generate Random Number. Select the desired length and click Apply. Hey, maybe you recall a previous webinar we did. We had some best practices on creating the ID length. Remember? You make it 3 digits longer than the number of users in the company. So if you have 1,000 users, that's 4 digits. 1, 0, 0, 0, 4 digits. Add 3 more. Use at least a 7-digit ID number. Of course, if you have a small group of 10 or 20, a 4-digit number will suffice. You can import numbers from Active Directory if they exist there. In the primary or secondary number field, select Sync from AD/LDAP field. And in that field name, enter the name of the field containing the card ID numbers. Hey, note there's another way here to create random ID numbers just by using the auto-generate random ID numbers if the user account is blank. And another way to get ID numbers into PaperCut is by using the Batch User Import and Update feature found on the Users tab. Complete the fields in your tab-separated file using this table. Don't worry, the information is right in the Select File area under More Information, so you don't have to copy this down. We've talked about this on other webinars, and really this bears repeating as well. The easiest way to create a TSV file is to use Excel, and then save the file as text, tab delimited. In the brains of PaperCut lies the database, full of information to recall. Unlike MFP tracking, you don't have to zero out values every month. You just run a report against any date range that you want. And there's a variety of formats to choose from. Healthcare administrators love the reporting in PaperCut as they're able to track what the users are doing to ensure compliance on policy and prevent one of those costly HIPAA violations that we just saw. All reports have a PDF option. Here's an example of the two-page executive summary, a concise document providing top users, printers, color, and black and white breakdowns, as well as a graph for daily printing and time of day. Very beneficial to analyze who, what, when, where, why, and how people are printing. Many reports have HTML view screen options, and this way you can quickly look at the report right on your screen. And then there's the CSV reports. Most of the CSV reports have much more data in them than the PDF or HTML, and you can easily open these in Excel to create pivot charts or extract other data that you need for analysis. All reports are capable of automatic generation with results sent via email or deposited in a secure file folder on the network. Further customization of reports is available by running on an external database and using one of the many report creation tools that are available. Most popular, arguably, is Crystal Reports. Now, PaperCut has always had some customizations available for the look and feel of the application. Version 17 has enhanced this capability to make it easy to change. You know, it's kind of like plastic surgery, except it's easier, faster, and I tell you what, a lot less painful. You can always implement web browser single sign-on to integrate PaperCut MF into an organization's intranet portal, or change the URL or link on the user client. Now, for your showrooms, place your logo on the screen for better impact, or better yet, grab an image or two from your customer, create a customized look and feel for them as they come into your showroom for the demo. You know, after you modify a couple of these, you'll find you can create a very cool customized demo in just a few minutes. Now, just imagine how your customer will feel if you took a little extra time to give them an idea of what PaperCut will look like in their hospital, their clinic, or maybe even their doctor's office. Under the Options tab, you can scroll down to the bottom, and you're going to find the Branding section. You can customize the initial login page, the admin web interface, user web interface, and report headers, as well as change some of the color scheme on the buttons too. You can even change the text box to provide easy to understand instructions for the end users. Add a little bit of HTML code to change the text color, insert breaks, as well as font color and size. The user client can also be changed, including adding a logo, background color, web links, text colors, hover colors, even the color of a negative balance. Many other options are available. Check out the More Customization Options link in PaperCut at the bottom of the Client Software section. Watermarking, another feature that I've seen customers in healthcare need to use, as it provides a digital signature on the document. Now, this feature is currently available for printers using PostScript, PCL5, or PCL6 drivers only. I briefly showed you earlier where to add the watermarking. You click the Printers tab, select a printer. In the Advanced Configuration area, select Apply Watermark Digital Signature to All Pages checkbox. And here's where you can configure the text, add variables. The list is right there for handy access. Select gray level, font size, even the positioning of the watermark. This is an example of a full page watermark. It includes the name of the user, the date and time printed, as well as the digital signature. Another benefit to using watermarks is misprints or discards do not show up in the recycle bin. That could be a HIPAA violation as well. You know, the document has the user name on it, so they're not going to throw it in the trash. It really encourages them to use a shredder instead if they need to destroy that printed document. Here's one of the newer features of PaperCut that many overlook. And if you don't have a, you don't even have to set an appointment here with your doctor to get this health check. You use it whenever you want with a utility that monitors the status. Here's some of the items that we're able to watch using third-party monitoring tools: site servers, print providers, details of database connections. You've got details of devices in error, devices that haven't processed a job for a defined period of time. Printers in error, application server with system information, resource metrics, license details, system-level stats to help track trends in the print environment, including number of print jobs, held jobs, errors, and warnings. PaperCut's health monitoring works with PRTG, Zabbix, Nagios, virtually any other system that works with a JSON format. That's JSON. Now, this info can be used to trigger alarms for urgent print outages and monitor real-time activity on the server like CPU and memory. It's done with a series of URLs that are accessible in the PaperCut interface to easily cut and paste into your favorite tool. Here I have PRTG running, and besides RAM and CPU usage, I'm tracking current users and license renewal information. So let's flip the chart over to another view, and here's a screenshot of PRTG that's tracking my license renewal. And as you can see, I'm getting near the point where I need to obtain a new license to keep PaperCut up to date. How easy is that? And with that, we're going to wrap up the actual presentation part of today's webinar. I certainly hope you're feeling better now that you know how PaperCut fits in the healthcare market. But if you're not, just take 2 aspirin and call me in the morning. We'll get to your questions in just a moment, but first up, a question for you for your chance to win a cool t-shirt or polo. And for ACDI, I'm Doc Balgi.